Hi guys, and welcome back to another episode of The Connector. I am your connector, Ariel Levitt, and I am here to connect you to people that are doing innovative things. I got connected with Geraldine and now Carmine, and we got connected. Geraldine and I were talking, and she's like, I found out this new company that is definitely innovative, thinking ahead, wants to help the community, wants to help more than just the community, really the country, the whole world. Oh, we're going to get there, but help the United States to get your pharmaceuticals at a more reasonable price and not be paying the crazy amounts that are expected of us. And so when I was talking to her, because this is a subject that really heats me up, I was like, oh my gosh, you need to come on the podcast. We need to get you guys on here so like that we can really educate everybody a little bit more, and I can get educated more. So anyways, so welcome, Geraldine and Carmine. Welcome.
Welcome. Thank you.
Thank you.
Good. So, all right. So there's two different companies that you guys are part of and talking about and educating the consumers, the public, right? Like, so there's Premier RX and then there's Direct RX. YourDirect-Rx.
Yes.
So there's two different areas. Let's talk about both of them. Let's talk about why this company is coming out and trying to change this industry and ruffle some feathers, because I love a good rebel. And
so, you got one here, that's for sure.
Yeah. So let's talk about what this company is doing and how is it ruffling some feathers.
Okay, so I'm Carmine Perella. I'm the COO of Premier RX and YourDirect-Rx. And the reason why I got into this industry was when I got my own education about what really goes on, I became very angry about what I found. And everything I'm going to talk about is all third-party verified. It's all my own research. I could talk pretty confident and congruent about it because I know what I'm talking about because I've done it for myself. And what you learn is this is an industry that is a $500 billion market that nobody knows anything about. And the reason why is there's three players that control over 80% of this massive market. And that is Caremark, which is owned by Aetna. That is Express Scripts, which is owned by Cigna. And that is Optum Rx, which is owned by United Health Group. What most people don't realize is a PBM, which is a pharmacy benefit manager, they're the one that's controlling your drug plan, your prescription benefits as we know it. And when you get a major medical policy, within it is your hospitalization and is also your physician network. But most people don't realize a separate component of that is your prescription benefits. It's not part of your major medical. It's as separate as your dental or vision would be to that policy, and that's called a PBM. And what happens is, because these big three are insurance companies, they embed their PBM within the policy, and the average broker does not know how this game truly works. Now, there's 9 bills in Congress right now about the PBMs. They're under attack from everybody. Back in April, Governor Hockley of New York City rolled out a $705 million Medicaid program. And right in the article, the senator says this is a win for everybody involved, except for the drug company middlemen who no longer be able to rip off the state's taxpayers, patients, and providers. And I'll tell you this, back in October of 18, the Patient's Right to Know Drug Price Act was passed. And I read it. And you want to talk about getting angry about something. Actually, what we don't get to know about own medical information is pretty incredible. But what really bothered me was before they passed this act, it was actually illegal for a pharmacist to tell us the difference between a cash price and a copay price when we went to the counter. And I said, what the hell is going on here? What we don't realize is that you can create most generics for a penny to 2 pennies a pill. But yet, the Kaiser Foundation reports that the average American pays $11 to $17 for generic drugs. Now, why is this happening? Do you realize we pay 3 times more for drugs in this country than any other country? And the reason why is nobody else has a PBM. Now, the PBMs were basically an industry that started in the 60s. And let me give you just some interesting history about this. They started in the 60s to keep the drug prices down. Now, in 2015, Martin Shkreli of True Pharmaceuticals took a drug called Daraprim and took it from $17 to over $750. It was a famous case. He paid a $64 million fine and was kicked out of the industry forever. But what that did was it illuminated what was going on in the industry that nobody knew anything about. And before that case, since the 60s, there was only 26 PBMs. Since that case broke, as of last year, there was 66 PBMs. And now there's a gentleman called Mark Cuban who has jumped into this arena as well, and everybody knows him from Shark Tank and owning Marix. But what's interesting about Mark started Cost Plus, his direct-to-consumer website. Now, I'm not going to go too much into what he's doing because he is helping, but he's not helping as much as you think he is because of his pricing model. The bottom line, though, is this. He got involved because a doctor wrote him an email after hearing about what happened with Martin Shkreli with True Pharmaceuticals. So that case literally changed this industry. And now there are companies coming in everywhere that want to be involved in doing something about this, which is great. It's a positive for everybody. Because these PBMs are so large and powerful, that's why they've been protected. The fact is, nobody in Washington really cares to help because the biggest money, the biggest lobbyists sit in this industry. And this is a pay-to-play game. And like I said, there's 9 bills sitting there right now that are buried because nobody wants to really do anything about it because it's a lot of money that a lot of people are making on the average American's back. So what we did was we designed a program that was a membership-based program. Think of Costco. Costco doesn't make their money on selling us the food. They make their money on the memberships. We don't make our money on the drugs. We give them the drugs for just over cost to cover our cost. We make our money on the memberships. So what we've done is we've designed a model where instead of coming in this industry to make money from it, we show people how to save money in this industry. And Premier Rx is our business-to-business model where if we wanted to sit down with a business owner that is self-funded, we can show them how to carve out that PBM and replace it with our program. But then we designed YourDirect-Rx, and that's our voluntary model. What does that mean? Well, think about a company that has 1,000 employees. They're probably going to have an opt-out rate in the mid-30s to high 30s on average, depending on the industry. That means that of 1,000 employees, 300 or so said, you know what, my spouse has better insurance, or I just can't afford it. So we rolled out YourDirect-Rx as our voluntary model. And now we can go into any company and say, okay, great. What do you do for those people that opted out, those employees? What do you do for 1099s? What do you do for part-time workers? Think about the fast food industry. Think about real estate offices, insurance offices. All those people are fending for themselves. And let me explain this to you, because this is another startling fact. Right now, there's no such thing as inexpensive insurance. If you go right now to the health marketplace and you want to cover your family, depending on the state you live in, you're going to pay $3,000 to $13,000, $15,000 a year in a deductible. Now, what does that mean? That means that you have, God forbid, I need insurance.
Sorry, there's a phone ringing. We're turning off phones. Okay, go on.
I put mine on silent, but did not kill it. Apologize for that. But if you're going to the health marketplace right now and you need to get insurance, your deductible is so high that do you really have anything? No, because you're going to pay everything out of pocket, right? So what you really have is, God forbid anything happens to me, insurance. But you don't have anything for your day-to-day. So this program is very inexpensive but very comprehensive. And we designed it to help the average American. And let me just give you a couple quick statistics. Last year, let's go to 2022 because now we just moved into 2024. In 2022, over 26 million Americans had no prescription coverage. Okay? And they just released a report that 50% of Americans denied a prescription at the counter because of cost alone. Now think about that. So when a brand gets a patent, it's good for 20 years. But then after that, really anybody can come in and make a generic version of that. And you can make it for a penny to 2 pennies a pill. And yet we are getting robbed and taken advantage of left and right when we go to pick up a prescription. So we designed this to drive down the cost for the employer and the employee, and we made it more convenient. We added a teledoc component where literally within 6 to 9 minutes, 24/7, from the comfort of their own home, somebody can have a doctor, a board-certified U.S. licensed doctor, on that screen in front of them. And think about the convenience, but think about what it does for an employer as well. Because we're going to give them instant medical attention, well, they're going to drive them back to work 1 to 3 days sooner. So productivity is going to go up. But we're also giving them instant medical attention, which is also going to drive down the cost of an emergency room visit, urgent care visit, and building out the other side of that copay bill. So this is all designed for two things: convenience and savings.
So I guess my question is, like, how many drugs or whatever would somebody have to be on for it to be worth it for them? And it's only for generic. So I have a couple questions coming up.
Yeah, no, that's fine. That's fine.
So
Absolutely.
like, is it only for generic drugs? Is that where it's...
No, not at all. Not at all.
And then how many drugs would somebody have to be on, or prescriptions, I should say, not drugs, whatever. Would somebody have to be on for it to be worth it for them? Because like you said, it's a Costco membership, right? So you're paying a flat fee every month, and then how much are you? Yeah.
So let me handle both sides of that question, right? So, because I wanted to give you a basic understanding of the industry first, because I think it's important for your listeners to really understand this. And I promise you,
and myself, like
exactly.
I'm getting educated too.
Everybody I talk to becomes educated, and this is all the stuff I found for myself. And I was educated myself on this industry, and when I learned it, I was like, oh man, I got to share this with people. I'm the type of person that once I hear something and I truly believe in it, I only talk about what I believe in. I don't sit here to blow smoke, right? I'm really a passionate person about something I truly believe in, or I don't talk at all. And when I found this industry, education on this industry, I became consumed with it. I became like, there's something that has to be done here to change this for the average person. Excuse me 1 second. Okay, now it's done.
It's on silent.
So let me just go back a little bit so you understand. Okay, when an insurance policy is given, on average, you're paying $100 to $140 a month, meaning the employer, for that PBM within the policy. Okay. Now the way they get that is one of three ways. They'll either put it right in the policy, so you'll see the PBM costs $130, $140 per person per month, or they'll do it two other sneaky ways. One, they'll do what's called a spread between the difference of what they take in for the policy and pay back to the pharmacy, or two, they will take it out of what they call rebates. Now, the reason why this industry has gone so upside down is because the manufacturers give the PBMs rebates they're supposed to be passing forward. And most of the time, they keep a good portion, if not the whole thing, for themselves. And if you think I'm crazy, think about this. They're building a CVS on every corner, but yet nobody goes in any of them because they keep all the Aetna rebates. Okay? And this is how this industry truly works. So what has happened is the manufacturers have raised their prices continually to offset what has now become a kickback or a whatever you want to call it, a little thank you to the PBM. And that is one of the reasons why we pay so much for these drugs. So,
I mean, a lot of people don't look at their insurance and what they're getting, right? They're like, I need this policy. This sounds good.
That's it. Exactly.
I think it covers my, you're definitely not looking at your drug side of things or your PBM. Or like, no, I didn't even know that was part of it, right?
Absolutely.
Or that you could opt out of that.
Absolutely.
And
most people don't know.
No.
Trust me. I sit down with benefit managers. I sat down with a benefit manager about a week ago. 23 years as the benefit manager. She's like, come on, I didn't understand half of this. I did not know this. Yeah, because who's going to tell them, right? Who's going to tell them? Because the brokers don't know how this really works because nobody tells the brokers.
And you think you're getting insurance, it's supposed to cover all the things. It includes this, whatever, right? Like that you're not opting for like an a la carte. You're opting for, you think you're getting a...
Correct. So the way it works is 82% of companies are going to be self-funded. 18% are going to be what they call fully insured. We just pay a carrier and you just pay a premium. That's your policy and they cover everything there. But when you're a larger company, let's say a couple 100 employees and up, it's too expensive to fully insure and it's not worth it, quite honestly. So they self-fund. And that's where they do what's called a carve out, where they'll carve out the PBM. And now a lot of companies are starting to come in to help or do something about driving the cost down. As anything, if you look back in time in history, it started with the telecom industry, right? Remember when we were kids, you're paying 35 cents for a long distance call after 9 o'clock, your parents would say, right? Because the rates go down. And then they deregulated that industry. And now it's, you can just call anywhere for free, right? And back in the day, Costco had 7 cents a minute and all that, right? Well, then they did it with the deregulation of the energy industry as well. Well, they're going to do it with this industry. Over the next 3 to 5 years, you're going to see a massive change in this industry. Why? Because so many people are starting to see the gig is up now, right? Governor DeSantis down here in Florida, he signed the Prescription Drug Reform Act into law. He said PBMs and Big Pharma have escaped the public eye for way too long. Back in August, Blue Shield of California came out and said they were dropping Caremark, CVS, as their PBM. And it sent shockwaves through the industry. Well, just in January, last month, Tyson Food has decided to get rid of Caremark as well. And they're the first Fortune 100 company to say, no mas, we're done. So this is going on, whether people like it, know it or not. And this industry will be really, I think, disrupted for a very long time in a massive way, and hopefully for the better for all of us. But what we're trying to do is drive down the cost and get the word out that there's something seriously wrong with this industry. And the fact is, nobody's going to help us unless we do this ourselves. So to answer your question, this is a full PBM replacement is what's called. And that means that we have a PBM behind us, but a transparent one that is not charging those ridiculous prices. We have a rebate aggregator, which also means we're going to give the rebates back to the business owner. What a concept, right? And then we'll also have a teledoc component. We have a GLP-1 claim consultant. Now, what does that mean? Well, right now, the biggest rage out there is the Ozempics and the Wegovy. Everybody wants to lose weight, but nobody really wants to go, do the time, right? They just want to take a needle and but what's happening now is these claims are causing the cost to go up on these employers so much because the pharmacy doesn't care and the PBM doesn't care. The only one really getting taken advantage of is the business owner. So we brought in a GLP-1 consultant that is denying 5 out of 6 claims right now. Because if you don't have the blood work to support you have a diabetic condition, guess what? I'm sorry, but go to the gym, get a better diet. That's just kind of how it works, right? And I always said if it ever came in a bottle, everybody would have a great body. And now that's exactly what's happening. They're saying 1 out of 4 people is going to be on some form of Ozempic semaglutide over the next 12 to 16 months. It's crazy what's going on in that industry, but it's going to be a massive bill that's going to hit a business owner, and they don't know it's coming just yet. So that's really a sad thing. So anyway, on the Premier Rx side, we have a full PBM replacement. Now, what does our prescriptions cover? And this is important. So we offer 1,000 generic drugs delivered to the door on a 90-day supply. So when they pay the membership fee, and our membership fee is $59.95, okay? So we're taking them from $100, $120 per person down to $59.95. And that's one of 6 ways we're going to help them save money. So when you really think about this business model, it's absolute game changer for a business owner. We're showing 25 to 30% savings on their out-of-pocket drug spend. So we have a 90-day supply to their door. Now, this covers 95% of the average maintenance medication that a person would take. So your blood pressure, cholesterol, diabetes medication, inhalers, birth control, it's all in there, okay? Because the average person takes maintenance medication, they take generics. 80% of prescriptions written are on generics, but 80% of your cost comes from brands. So you have to be able to match the big 3 on the brand pricing, which we can because we have a PBM behind us. And we have the same pricing as the big 3. Now, we also have free antibiotics that can be picked up at over 68,000 pharmacies nationwide as well. And then we also have where we have a Canadian connection as well, where we can get some branded specialty drugs from there as well. And that's kind of sad that we have to go out of the country to get a better pricing for drugs. I mean, it's just crazy. And DeSantis, actually, governor of Florida, is the first governor to actually, he started that just last month, where now he's going to let Canadian imports come in here. So there's an upheaval in this industry right now. So we're really excited about what we're doing. And for YourDirect-Rx, which is our voluntary model, you receive everything the same way. So you're going to have all your prescriptions covered, teledoc component where you're going to have access to a doctor, and you're also going to have the opportunity to add your spouse for $4 a month, and add all your children under 18 for another $4 a month. So for $67.95, we're giving the average family some real peace of mind that they have access to a doctor and they have all their prescriptions covered. Because 40% of people go to the emergency room just to get a prescription to feel better. And you'll sit there 2, 3, 5 hours, and your bill will be pretty significant by the time you walk out of there.
So it's almost like urgent care in a way, right? Urgent care meets, this is a very different concept. So I want people to like really grasp it. And I also want to.
Yes.
But like you're saying, like you have the teledoc component, it's kind of urgent care-ish, right?
Well, yeah, but the difference is you're not going into an urgent care office, sitting there in a waiting room. You're actually going to go on an app. You're going to click for the doctor, and we have urgent care. We have mental health as well. And you're going to click on it, and within 6 to 9 minutes, the doctor is going to pop on that screen, and the doctor is going to say, hey, what can I do to help you? And then they can send that prescription to your local pharmacy 40 minutes later. And now you go pick it up. So instead, think about this. Most people get up in the morning and not feel well. And they'll go, you know what, I'm just going to stay home today. And then they'll hope they'll feel better. But typically, you're getting worse. So that night, you're going to feel even worse. And then you're going to take off the next day again. And then you're going to go, you know what, I got to go to the doctor. And then you're going to make an appointment. You're probably going to go 3, 4 o'clock in the afternoon. And then you're going to pick your medication up at CVS or Walgreens, wherever it is, probably 6, 7 o'clock at night. And then you're going to get a little medication in you. And if it happens on a Wednesday, you're going to bang out the rest of the week. Let's be honest, right? That's what people are going to do. Now, when you give them instant medical attention at 6 o'clock in the morning when they get up and don't feel well from the comfort of their own bed or their couch, because they're not going anywhere, they're just going on their, they're going to go on their device. And now they're going to get instant medical attention. That doctor is going to say, okay, you know what, let's get you a Z-Pack, or let's get you an antibiotic. We'll call it into your local pharmacy. Go pick it up 40 minutes later. Boom. Now they have instant medical attention. Now they have medication in them immediately. And that's the difference. So it's convenience, and it's also cost savings. The program is all designed for convenience and cost savings. That's the way we put it together. And the reason why it started, just to be honest with you, the CEO of the company, a gentleman named Randy Case, had moved from from California to Vegas. And he's got high blood pressure and cholesterol, and he was running out of his maintenance medication, and he started to freak out because he couldn't find a doctor. And the doctor that would see him charged him over $200 to see him on short notice because he needed his maintenance medication. He goes, this is crazy. He said, there's got to be a better way of doing this. Well, he happens to be very good friends with the president of the pharmacy, and he said, you know, I just moved here. This is crazy. He goes, you know what? You might want to listen to a conversation we're going to have, because we're about to build out this. At this point, it was only going to be a formulary that would be delivered, the 90-day supply. It wasn't a full PBM replacement. And he listened to the conversation. He said, wow, this is pretty incredible. I know what I just went through, but we got to make this a little bit more robust. You know, we got to bring a teledoc, right? Because I know what I had to go through just to get access to a doctor moving here, and how stressful it was. I was going to run out of my maintenance medication. So that's how the program really was born. It was born from Randy's situation, and just then walking in, talking to the president of pharmacy, and serendipity, right? He just happened to be in the right place at the right time. But that's how this whole thing came together. And what we see here is an absolute massive need to help a lot of people. And that's what this is all about. You know, some people say, well, you know, it's about money and this. Listen, you'll make enough money if you do enough good things to help people. And this is designed to add value to people's lives and make the money because of it. So when we sit down, whether it be a business owner, an individual, we just want to help them. We just want to show them a better way that we've designed because of what we went through in our research about what goes on in this industry. And we continually add more components to that. We're going to be adding virtual primary care. We're looking into right now adding free lab work as well. So, you know, we're going to try to put as much comprehensiveness underneath this umbrella as we can to help the average person get as much as possible for the best price. And that's what this is all about.
All right, we're going to talk about more in just a second when we come back from the commercials.
You know, when you think about the average, let's say it's a single mom, and she doesn't have medical insurance because she's got 3 littles.
Yep.
And she's working, and one of those littles goes to school and comes home with strep throat.
Yep.
You are talking about 3 copays, not only for the medication, but for the doctor visits, because they don't get sick all at the same time.
Correct.
And the doctor will not write that prescription unless you bring that child back in. So now she's got to take off work to bring in number 1. She's got to take it off work to bring in number 2. She's got to take off work to bring in number 3. She's got to pay a copay at the doctor's office for each of those littles. And then she has to pay the copay at the pharmacy for the antibiotic.
Yep.
With us, that would be completely covered. In fact, she would get the coverage on the first one on the teledoc, and then it always goes through the family. And it goes through the family sometimes twice. Like, they just keep going around.
Oh, absolutely. You can't get rid of it sometimes. It goes around the house, you know. It's just, and especially when the kids go back to school, somebody else either has it or they give it, you know, like it just keeps
going.
I raised 3
round
children.
and round.
I know what that's like. And it's, you know, oh my God, once somebody gets sick, it's like, we can't get rid of it, you know?
So I guess my question is also like, so for, if somebody's looking at their insurance, right? They're in, like, I guess they would ask their agent, what is my PBM? Right. So like, because I want to go through the steps. Like, what are people going to ask? Like, after they listen to this, they they're like, okay, I want to change it. Right. I want to know how much I'm paying. Like, am I paying $140? Can I pay now 60 or 59, 95? So can I, you know, what am I paying for that? And so are they going to go talk to their agent? Are they looking at their policy? Where are they finding
Are we
this?
talking individual? Are we talking, my question is, do they work for a company, and are we talking to an employer right now that wants to say, hey, wow, this is interesting. Can we replace our PBM? That's a different conversation than an individual, right?
Yes.
So an individual that has insurance, they can pick this up even as an overlay, because the truth is their benefits, what they have and what they're probably paying for, whether it be deductible. I'll give you an example. I was talking to a head of an HR. He said his son, he's got United Health Group, his son was sick, had strep throat, and it was $50 just to call his own teledoc on his policy. And he said, this is incredible. So, you know, it depends on where you're asking the question from. If it's an employer, then they're going to look at their policy. If they're self-funded, we can carve that out for them.
I think what you're, but are you just asking, how would they take the next step? Just have them contact us, and we'll walk them through it. We'll
you could do that.
How we
as
can
well.
best meet their need. Are you an individual? Are you a company? Like, they need to reach out to us, and then we could walk them through the steps. We'll have some preliminary questions that Carmine would ask, especially if it's CEO to CEO. Like, we get decision makers in the room.
Yes.
Let's take a look. Let's do a comparison. And then we could move forward with that. So if they're trying to figure out who to ask or where to start.
Yes. So I guess that's one of my questions. It's like, where are you starting? Because, like, obviously there, you know, your average listener,
I want to know more.
So let me tell you how I do this. If it's a business owner, we do a Zoom presentation, and it's a consultation. So I'm going to educate them on the front end, because I found people just don't know how this works, right? So I'll give them, and I'll use a PowerPoint presentation. I'll show them, you know, Blue Shield breaking away from, you know, blah, blah, and I'll show them so they could see what's going on. And I'm not kind of just saying it to them, but they see third-party verification. I got the articles from, you know, Governor DeSantis. So I show them that. And then what we do is we ask them for a 3 to 6 month drug experience, which means I'm going to look at their actual prescriptions, dose, and what they paid. And I'm going to match that apples to apples, because what I'm going to do is I'm going to take all their generics and I'm going to deliver it to the door on a 90-day supply. So all those copays are going to go away, right? And then I'm going to take all their brand specialty drugs. I'm going to get that to the PBM. It's going to go to the rebate aggregator. And now I'm going to come back with how much I could save them on rebates. So I'm doing an apples to apples comparison, saying this is what you spent and this is what you would spend. And that's what we'll do for the business owner. Now, for the individual that either doesn't have insurance, or they're saying, okay, I have insurance, but it's not that good, blah, blah, blah.
I was going to say, like, if you're a 1099, right? Because there's so many people that are 1099s. They're coming up with their own business. They're doing their own thing, right? So how, as a 1099, you don't have great insurance. You don't have somebody, whatever.
Yeah, exactly.
So what can they do for themselves as a small business?
we have, you can just sign right up on YourDirect-Rx.com and you can just become a member. It's that simple. As long as you get in before the 22nd, you'll be covered the first of the next month. If not, you're going to have to wait, because we only submit the file once a month. See, what we did, which has never been done before, is we signed up YourDirect-Rx as a member group, because PBMs won't take individuals. They only take businesses, unions, they only take associations. So the average person has not had the opportunity to do what we just did. So what we did was we signed YourDirect-Rx as the member group. We send over that file to the PBM as a block. And now everybody has that PBM coverage.
So you're joining like a big network.
Yes. We're doing something that's never been done before. We are offering to the individual and their family the same benefits as if they were sitting as an employee underneath an employer for a company.
See, and that's what I think the confusion is because it's a totally new thing that you're coming up with, this new concept, which is like, okay, we have to rewire our brains a little bit because not everybody's used to this, and not everybody's used to all of the, like the way this whole thinking is now.
Yes.
So, which is nice that you're being able to provide this to especially the individuals that are 1099s, and there's just people that just can't afford also, like their company might pay for half the insurance or whatever it is, and they end up opting out of the whole thing, like you said, and so now they're maybe they are employed with somebody, but they can't even really afford their insurance, or whatever it is. It's insane. Insurance is really expensive. It can be.
It's ridiculous. And years ago, you used to be able to get what's called catastrophic or hazard insurance. Nobody offers it anymore because they don't make any money on it. So now what considered a high deductible is now a normal deductible, right? So you're now at the point where they're not really doing anything for you, right? But everybody feels like, I need insurance. But for what do you need it for? When you think about it, it doesn't cover you what you really need it for. Now, God forbid you needed, open heart surgery. Yes, you're going to have your major medical for that. But the fact is, the average person day to day is paying everything out of their pocket. That's just the truth.
Absolutely. I will tell you, I have 3 prescriptions that I get every month. And I was paying $160 a month in total for these 3 prescriptions. I am the perfect example of why and how this works. And what's really neat is, as a referral agent, all of the people who come to me, I can do the apples and apples. Send me photos of your current prescriptions. Let me check our formulary. Make sure everything's on there. Now I can go for $59.99 a month. I have the Teladoc added, which I didn't have. I used to have to run to my doctor. And I'm saving all that money each month. I'm a perfect example. And I'm a healthy person who takes some things that help me remain healthy. So I'm the perfect poster child for how I'm saving over 50% a month on my prescription drugs.
Yeah.
And I don't have to go to the pharmacy for all of them anymore.
Yeah, they come to your door.
I don't have to go dropping in. Right to the front
I'm telling
door
you, it's a game changer as far as just convenience, right? Yeah. I mean, it's just to piggyback on what she was just saying, what's amazing is we have a lady that had an abscess in her mouth, and she got antibiotics, blah, blah. She wasn't feeling any better. So she called up Teladoc. And now these are all doctors that only work for the company. What does that mean? A lot of Teladocs out there right now, they vendor out to doctors. So they contract them. So they'll call at the end of the shift. They'll call between patients. They'll call in their off hours. So you could wait hours for them to basically get back to you. What we did was we found the company that only uses W-2 doctors. So on average, 6 to 9 minute wait time, 24/7. So now, no matter when you don't feel well, 2 in the morning, 3 in the morning, boom, you can call, right? So that she called up and the doctor said, you're not on a strong enough antibiotic. She started having back pain. She was getting septic. And he said, you know what, he gave her his cell number. He was a 30-year ER doctor. He gave her a cell number and said, you call me if you're not feeling better in 24 hours, but I promise you, you will be. And she was at the point where we don't know how bad it would have got for her because she was really starting to have some serious issues. And to have access to that from the comfort of your own home, not only just have access, but to have the expertise at your fingertips is incredible. So that's what we've done. We've put a program together that gives everybody access to a doctor and all the prescriptions covered. So,
yeah, no, I love that you guys are really changing and shaking up the industry and allowing us as individuals or business owners or whatever it may be to be able to really provide other options. We need other options. It was becoming way too monopolized. And
absolutely.
like, I felt like we were between two different, it's three, I guess.
Big three, yeah, the big three.
I mean, even I'm surprised Blue Cross Blue Shield doesn't have their own, whatever. Yeah. But anyways, it's really nice and refreshing that you guys are offering this, and I appreciate it. And I know a lot of the listeners are going to have a lot more questions. Mm-hmm. So when I get the follow-up questions and everything, I will definitely see if we can, talk through those more and respond to everybody. But I would love everybody to be able to reach you guys directly. So where is the best place for everybody to ask questions, find out more? What's good?
So it's Geraldine, Geralin, at premier-rx.us. They can email me. I'll send them the appropriate links. If we need to schedule calls, we'll have Carmine in on the calls with the businesses. If they're direct links, I'm happy to walk them through the process and make sure that we're qualifying them for the program and it's a good match for them.
Yeah, and really go through it and assess it. I love it. Thank you guys so much. This is so fantastic. I'll put everything in the show notes so everybody can click the links, do all the things, and find out more because I think this is amazing. You guys are movers and shakers in this industry, and I am happy you guys are shaking it up.
Appreciate the time. Thank you very much.
Thanks, Saria.
Before we go, you guys, if you can subscribe, write a review on the podcast, it really does help. I appreciate all the reviews that have been posted. If you find something in this episode that you are like, hey, I want to share this, everybody needs to know more about this. Please send the link to a friend and share the podcast. That's how we get the word out and get more connections going. All right. I'll see y'all next week for a whole new episode.